Hi, this will be our final discussion on shortness of breath. We will address interstitial lung disease, bronchial carcinoma, and occupational lung disease in this video. Interstitial lung disease is a group of disorders that cause scarring or fibrosis of the lungs. The scarring causes stiffness in the lungs, which makes it difficult to breathe. Some causes include sarcoidosis, fibrosing alveolitis, and extrinsic allergic alveolitis. Sarcoidosis is an inflammatory disease that affects multiple organs in the body, but mostly lungs and lymph glands. In people with sarcoidosis, abnormal masses or nodules, called granulomas, consisting of inflamed tissues, form in certain organs of the body. Also, there may be bilateral hilar lymphadenopathy, which can be detected on chest X-ray. The onset usually begins in the 20s and 30s. It can be accompanied by fever, fatigue, and joint pain. It can also present with a skin rash called erythema nodosum. A young adult with fever, fatigue, joint pain, and erythema nodosum is likely to be a candidate for a diagnosis of sarcoidosis. Sarcoidosis may resolve spontaneously, but treatment will be needed if there is no improvement within 6 months. There can also be additional involvement of other body systems, such as the eyes, kidneys, and nervous system. Treatment will be made with corticosteroids to reduce inflammation. The corticosteroid prednisone is the most commonly used treatment for sarcoidosis. Disease-modifying anti-rheumatic drugs, called DMARDs, may also be used. These are used to treat an overactive immune system. Examples include methotrexate, azathioprine. Potential side effects can include liver damage. Also, monoclonal antibodies may be used to treat sarcoidosis. They are used to treat overactive immune systems. Referral should be made to a pulmonologist and rheumatologist if a patient presents with shortness of breath from sarcoidosis. They can work together to manage this disease process. Fibrosing alveolitis is a disease of unknown cause, mainly involving the gas exchange portions of the lungs. Its clinical manifestations are mainly respiratory, and it may be associated with other disorders, such as rheumatoid arthritis. It's a common diagnosis in patients presenting with interstitial lung disease. It usually presents in the 50s and 60s with the same type of symptoms mentioned above. A lung biopsy may be needed for diagnosis and staging. Treatment is with corticosteroids and immunosuppressives such as azathioprine or cyclophosphamide, and these also have side effects. Extrinsic allergic alveolitis. Extrinsic allergic alveolitis is a diffuse inflammatory reaction in the small airways of the lungs and air sacs. It is caused by the inhalation of allergens. These allergens can be spores of microorganisms. Extrinsic allergic alveolitis can also be caused by repeated exposure to animal or vegetable dusts, usually but not exclusively in occupational settings. Treatment is prevention, avoiding exposure by wearing appropriate masks when exposure is possible. Corticosteroids can be used to control acute symptoms. Some examples of allergic alveolitis are farmer's lung, from exposure to moldy grain and straw, and sugarcane worker lung, from exposure to moldy sugarcane fibers. But there are many more. Bronchial carcinoma. Bronchial carcinoma may grow into the lung lumen and spread to lung tissue. Eventually, the neoplasm can spread to regional lymph nodes and distant organs, such as the liver, brain, and bone. More than half of the cases of bronchial carcinoma can be associated with shortness of breath along the disease process. Metastatic cancers spreading to the bronchi may also be a cause of shortness of breath as they progress. Treatment can be complicated when patients have coexisting chronic bronchitis and emphysema. Referral should be made to a pulmonologist for treatment. Occupational pulmonary disease. A number of acute and chronic lung diseases can be attributed to the exposure to noxious substances in the workplace. We just discussed extrinsic pulmonary alveolitis. Lung cancer, due to asbestosis and various hydrocarbons, is another example. Pneumoconiosis refers to the accumulation of dust in the lungs and the reaction of the lung tissue to these dusts. The result is a chronic fibrosis, or scarring of the lung tissue, resulting in the inability of the lung tissue to function normally. Examples of pneumoconiosis are coal miners' pneumoconiosis, which can result in massive scarring of the lungs due to inhalation of coal dust. This results in severe shortness of breath. Ship workers' pneumoconiosis, resulting from the inhalation of asbestos. The disease includes thickening of the pleura, mesothelioma, and increased bronchial carcinomas. It usually takes 20 to 30 years to develop. It is not limited to shipbuilding workers. It is evident in those who work in mining, power stations, and insulation, installation, and removal. Referral should always be made to a pulmonologist. We will end our discussion of shortness of breath at this point. I think we have covered enough information for you to confidently approach your visit to your doctor. Well, I hope this helps. Have a good day.